Thank you. I'd like to welcome everyone to today's event, which is the seventh in a series of educational programs that are a result of collaborations between multiple groups at Morgan State University and Johns Hopkins. So together, these programs are designed to do three things. Firstly, to increase community awareness on topics related to aging, brain health, and Alzheimer's disease and related dementias. Secondly, the event is meant to highlight the importance of diverse participation in research. And thirdly, to allow a platform for open discussion and engagement around these topics. So we will have two parts to today's event. We'll first start off with two brief presentations on the topic of caregiving in the context of dementia. We have a great lineup of presenters. Of note, we were originally meant to have three presenters today, but unfortunately, Dr. Robert Turner from George Washington University is unable to make it today due to a family emergency. However, we still have two great presentations, and following these presentations, we'll have a panel discussion that will be moderated by Dr. Reverend Alvin Hathaway Sr., and it will include an opportunity for the audience to ask questions. And to our audience members, please make sure that throughout the session, put any questions you may have in the chat box, or alternatively, save them until the panel discussion. And also, please keep your microphone muted during the presentation and panel discussion. So before we dive into our first presentation, I would like to acknowledge our event organizers. So this event is presented by Morgan State RCMI program, Ascend program, and the newly established Center for Brain Health Research. It's co-sponsored by the Morgan Cares, which is the community engagement core of the Center for Urban Health Disparities Research and Innovation here at Morgan State. And it's also co-sponsored by the Johns Hopkins Alzheimer's Disease Research Center and the Johns Hopkins Alzheimer's Disease Resource Center for Minority Aging Research. So before we go on, I'd also like to mention a study that was recently done, which includes two regions near Baltimore, which were estimated to have some of the high prevalences of Alzheimer's disease and related dementia in the nation. So as you can see from this PowerPoint on the left, I'll say it again, Baltimore and Maryland have the highest prevalence of Alzheimer's in the nation. That's something. And because we're very concerned about caregiving, there's some caregiving statistics I'd like to share. If you see on your right side, it says that over 11 million Americans provide unpaid, let me say that again, unpaid care for people living with Alzheimer's or other dementia. And so these caregivers provide more than 18 billion hours valued at more than around $347 billion. And so if the dementia caregivers could have a care navigator, it says that 3 in 5 would be less stressed and 56% would be better caregivers. And so because 70% of dementia caregivers feel stressed when coordinating care. And this topic is very important because November is the National Family Caregivers Month. And so hopefully we'll provide a link to the information I've just presented in the chat. And so this is a good time to be talking about caregiving, and I'd like to now present our first speaker, Ms. Etolia Biggs. So Ms. Etolia Biggs is an instructional systems development designer with over 30 years professional experience in system implementation, training development, and training delivery. Most importantly, through her lived experience, she is a caregiver for her mother, Eva, who has been living with dementia since 2017. Itola is an active member of the Binti Circle. This is a support group for Black daughter caregivers. In 2023, she connected with the Alzheimer's Association and became an advocate in Annapolis by testifying in support of a bill to provide additional funding to dementia caregivers across Maryland. She also has advocated during Maryland Advocacy Day in Annapolis. Itola is striving to find balance in her life by continuing her joy of travel, cycling, enjoying live music, and spending time with family and friends So today, Ms. Biggs will share her perspective as a caregiver. Welcome, Etolia.
Thank you, Valerie. And let me take a moment here to share my screen. And if I could just get a thumbs up, make sure you guys can see it.
We can see it.
All right, fantastic. So good afternoon, and thank you all for inviting me to share my caregiving journey. So we'll just jump right in. And I want to start with this quote. There are four kinds of people in the world: those who are currently caregivers, those who have been caregivers, those who will be caregivers, and those who will need caregivers. Caregiving is universal. And this is a quote from Rosalind Carter. And this is where I am currently. I'm currently a caregiver for my mother who needs caregivers, plural, because it really takes it takes a village. It takes more than one person to care for a loved one suffering with or living with dementia. So, as was stated, this is my lived experience. So, for almost the past 3 years, I've been a full time caregiver. And several years prior to that, long distance traveling back and forth from North Carolina before we moved my mother to Maryland in 2021. And at that time, when she was in North Carolina, I don't think I even thought of myself as a caregiver. So, oftentimes, as daughters and sons or other relatives, we figure we're just doing what we're supposed to do, for our loved ones without putting a label on ourselves. But I feel like sometimes if we don't put that label on ourselves, we may not realize that we need help, that there are resources, that we're not alone on this journey. So although we're not alone on the journey, some days it's very lonely. Some days caregiving gets to be very lonely. So my mother lives with me and I work remotely full time. So I like to say that after 5 p.m., my other full-time job of caregiving starts, and that goes until about 9:30 or 10 the next morning. When my sister, who is also a caregiver with our mother, she is at my house 3 days a week. And then we have an aide who comes 2 half days for 8 hours. So they are a constant during the work week because, as I mentioned, it's really hard to do alone. So I'm going to share some caregiver challenges, some changes in caregiving responsibilities and behaviors as the disease progresses, and also the importance of self care. So my mother has been diagnosed with Alzheimer's, technically since about 2017. Although initially, when they give the diagnosis, if it's early stages, they may not diagnose it as Alzheimer's, as I believe hers was probably diagnosed at that time as mild cognitive impairment. And I like to say that she is living with the disease because she is still very much active as much as she can be. The disease itself, progressively gets worse, but I like to think that she's doing the best that she can, and we allow her to do as much as she can do on her own. So I'm doing the best that I can to care for her, but there are so many challenges. I'm going to talk about just a few because if I really elaborated, we would be here for hours, and we don't really have that time. So we're just going to touch on a few today. So there are so many behavioral changes that dementia patients, will experience. And for her right now, sometimes not being able to express herself is one. And the ways that she overcomes that sometimes is by just vocalizing, so screaming. So sometimes just out of the blue, she may scream, and we attribute that to her being excited as opposed to pain. But you have to learn to, pay attention and be able to determine, really what's going on, because a lot of times they really can't verbalize what they're feeling. Another challenge or behavior change is the inability to remember things and make decisions. So, like, we can give her her food, and 5 minutes or less, she'll ask for food again. Bring me some food. We're like, you just ate. And she literally won't remember it. So, we have a lot of little tactics that we use, and one is having her write things down. So, we have her write down that she ate. And she still will ask, but we'll say, look at your pad. What time did you eat? And so this, something, just think about this is, something that goes on, every day, all day. She may ask the same questions 10 times in 1 minute. So I have to determine, how do I respond? Do I just keep answering her? Or one of the tactics that they train you is to redirect, change the subject, And some days I really feel like I just want to jump out the window if she asks me the question one more time. So you have to come up with ways to cope and mechanisms that are going to help you cope without, going into, I would say, a spiral of, being frustrated. Another recent challenge or behavior change is her sleep patterns. So recently she has began to get up in the middle of the night, or I should say in the middle of the morning, maybe about 3 o'clock in the morning. And we do have a camera in her room, but sometimes the notification, I may be deep in sleep, 3 a.m., I didn't hear it. So by the time I realize that she's up and fully dressed and she's in the kitchen and she wants to eat, and she may be getting food out of the refrigerator. She might be eating, or she might be making a mess of the food. So, that does become a challenge. And as things start to, trickle down and progress, you have to figure out, how we're going to make this work. So that's kind of where we are with that one right now. So, it's always get her back to bed. I have this lavender and chamomile spray that I'll spray on her linen and comforter. That appears to kind of help sometimes, but again, we're at the moment now where we're trying to decide what's the next step. Is it medication or what's going to be the next step for this particular challenge? And then, I call it dementia proof in the house. So we have a camera in her bedroom. We have the stove knob covers. Some people even have a lock for the refrigerator. We haven't gone that far yet. I've removed the rugs in places where she would, venture. I have an alarm on the balcony door, deadbolt on the front door. So it just goes on and on. So you have to come up with ways to address, these challenges. Then there's the financial strain for caregiving. So in this little image here, it looks like a few coins in that purse. And that's what it feels like sometimes, because it's really expensive to be a caregiver. And as Valerie stated during the intro, I mean, the number of hours and the number of unpaid caregivers, and in addition to the caregiving itself, but just the cost of being a caregiver. So whether it's supplies, so that could be underpads, disposable underwear, gloves, just the whole kit and caboodle for that, or an aide to come in. So we have to have someone to come in, and we don't leave her alone. And then also respite care. So the respite care is really for the caregiver. And that's very costly because a lot of times people don't realize it, or, friends may ask you to go out. Well, I can go, but I have to do some calculations. So usually it costs more to pay a caregiver than the event, but you have to pick your poison. So for me, most times I'll decide very specifically, which outings am I going to go on? So, 4 hours, that could very easily be $100 for the caregiving. That's not including the expense of whatever that event is. So, like I say, you have to pick your poison. You have to, you have to determine how you're going to maintain. And so we won't end up with this last one here, which is exhaustion. So that's physical and mental exhaustion. Being a caregiver does take a toll as part of your daily functioning. So I have to think about, what are my methods for preventing that. And I'll talk about that at the end of the presentation as far as my um, suggestions and what I do for self-care. And also with that, when people offer, sometimes as caregivers we feel like we have to do so much. Sometimes we feel guilty if we are leaving our loved one and going out and having fun, but that's another thing we have to kind of move past that, because we have to make sure that we're taking care of ourselves as well as we're taking care of our loved ones. So the challenges change as the disease progresses. And these are a few of the changes that we saw, I'll say, during the first few years once my mother was diagnosed. And some of these challenges, we've already dealt with. And when you have a loved one living alone, they can mask their behavior. And sometimes you think everything is well, but when you're really like in their presence, you'll find out that, wait a minute, I thought she was okay, but maybe really she's not. So my mother was able to continue driving once she was first diagnosed. As I said, that first diagnosis was not initially Alzheimer's, it was mild cognitive impairment. And you would be surprised that most states will allow patients, even with the diagnosis of dementia, to drive. And um, when she had I don't want to say it was the inevitable, but the incident where she was driving alone and she was lost. Um, and I remember my sister calling my brother and I on I think a three-way call saying Mom's missing. So, your heart drops and you're like, oh my God, because so many things can happen. Luckily, it was a safe event, whereas the police were able to locate her. And at the time, she was still living in North Carolina. Um, so we had to make the decision to take her keys. And it was, I would say, one of those love lies kind of things that I say where you don't tell the entire truth because Department of Motor Vehicles, it's really a process in order for them to like um, take their driver's license. So it's not just going in, saying, hey, she was just lost the other day and she's diagnosed with dementia. It's not that simple. So we had to really make a hard decision um, to take her keys. So that was, really removing her independence. And at the time, she was living in North Carolina, small town, no public transportation. So at that point, things really started to change. Another challenge that most dementia patients will have is hygiene. So you'll notice sometimes that they aren't taking baths, or they may tell you they took a bath, but you know that they did not take a bath, and working through that. So for us on a daily basis, it's a scream fest at the house because she does not like to take a bath. So we have to pretty much bathe her, assist her with bathing as much as possible every day. And also, one of our smaller tactics is posting reminders. So in the bathroom, we have a reminder: wash your face, brush your teeth, etc. So some of those things help, but we do have to, assist with the bathing. Finances is another thing that a lot of people will see at different stages in the diagnosis. Sometimes folks are able to continue to manage their finances, and she was able to do that for a while until one point we realized bills weren't getting paid. So then we had to gradually make the step to start to take over her finances. So we did auto pay for the bills that we could. And luckily, we were already on her account. So there are so many things that are like pre work that if you know the diagnosis or notice things that you probably should start to do up front, is making sure you have access to their bank accounts, also making sure that you are a health POA, a financial POA, so that you can, assist them. So we were able to control her finances. Now, of course, she does not do that any longer, and we just randomly put money in her pocketbook, so she has no clue how it's there. She doesn't even ask for it. So, so that works out. Another challenge was cooking. So my mother is or was the oldest of 11 children. So you can imagine, and from down south. So she was a great cook. And I think one of the telltale or early signs was she was forgetting recipes. And it may have been she was talking to my sister and she was asking about the ingredients for her infamous sweet potato pie. So she didn't remember like all of the ingredients that went into the pie. So that was like a red flag. She doesn't know what goes into the sweet potato pie that she makes all the time. So then we um, had to figure out, what to do next in that situation. So cooking itself, potentially becomes a hazard. And we added the stove knobs while she was in North Carolina, because at some point we did have to stop her from cooking because she wouldn't remember she had food on the stove. And at one point, we did have an aide to come in as well as her siblings to assist in preparing meals. But then the flip side of that was the meals were prepared for a period of time. And another thing, as I mentioned, she wouldn't remember, like now she doesn't remember that she had eaten. And when she was living in North Carolina, um, she was living with her brother. Well, same thing, she wouldn't remember that she'd eaten, so she would continue to eat. So she would eat all that food before the end of the weekend was over. So that also became an issue. So we had to make some other decisions with that. So, just a lot of things to think about. The physical activity, when she first came here to Maryland to live with me, we could get her to exercise. We would play music. We could get her to walk and move her arms. And that was great. And then after a while, she decided she didn't want to do that at all. And she is very strong willed. And sometimes I like to say she's verbally aggressive. not abusive, but aggressive. And we say that she is spicy. And so she decided she didn't want to, walk and do the exercise anymore. And even with a therapist coming in, she would tell the therapist, get some of these other people in here to walk. She wasn't going to do it. And she literally would not do it. And maybe she would get up the last like minute before the therapist was supposed to leave. So that really became it wasn't productive. But we do continue with a lot of music therapy. So in the morning, so for those of you who know the Mississippi Mass Choir, we put on the music in the morning. We let her listen to that in the car. I take her to a lot of outdoor events, so that's very stimulating and energizing for her as well. So you have to adapt your lifestyle. You have to adapt to their lifestyle. You have to adapt your house, and you also have to adapt your mindset. And, with saying all that, it's easier said than done. People say, oh, you just make those changes. I mean, practice makes perfect. I'm a long way from perfect, but, just a work in progress. So here's something that we have all heard. In the event there is a loss in cabin pressure, please secure your own mask before assisting others. And this is the same thing for caregiving. You have to make sure you're taking care of yourself. You cannot pour from an empty cup. As caregivers, we sometimes lose ourselves in the journey of caregiving. And it's really hard to unplug. We're often on autopilot. We're doing everything for our loved one. We forget to do things for ourselves. So the importance of self-care really is survival. It's preventing burnout, helping us to refuel, to stay healthy mentally and emotionally. Um, Otherwise, we're not really effective. We become the anxious one. We become sometimes just as potentially combative as our loved one, which they cannot control their situation, but we can. But when we don't allow ourselves, or when we have not, taken a moment to provide self-care for ourselves, we get in that situation. And the lack of some of the things that I listed here, when we forego these things, these are some of the things that are contributors to dementia. So as a caregiver, when we're not taking care of ourselves, we are putting ourselves in the path to be prone to end up on the other side. This is what I'll say for me, this is what self-care looks like for me. And as I mentioned, I am still a work in progress. This is not something that I've mastered, but I'm getting better with it. I mean, the physical health. So that's exercising, and that's also eating. So luckily with my mother, she eats the same thing every day, literally. So that's a blessing for me. But because she eats the same thing every day and we're able to control what she eats, her eating sometimes is better than mine. We don't give her soda. She drinks water all the time. She does not eat junk food. She doesn't eat sweets. So technically, she's probably, as I said, her diet is probably better than mine in some cases. Mental, spiritual, and spiritual health. This is key. This also includes therapy. So I literally this year, for the first time, started therapy. Um, it's a necessity. Spiritual health. So my prayer life with God has increased and probably has made me allowed me to get through a lot of some of the trying times and situations. Sleep is underrated. I have traded in my sleep for exercise many mornings. And that's something I never would have done in the past. I would get up and exercise, or on a weekend, get up and go out. But now sleep is more important because that sleep deprivation affects our brain. And that's another issue and thing that we see as it relates to dementia and the dementia related diseases. Social life, that's important. Social isolation plays heavy with caregivers. A lot of times, as I mentioned, we are so focused on caring for our loved ones that we don't take the time or make opportunities to get out and socialize. So that is another important self-care factor, or self-care tip, I should say. Respite. And this is one thing I never really knew the importance of respite until I joined the Benti Circle. And the Benti Circle is a support group for Black daughter caregivers. And when I attended the first annual respite retreat, it was a weekend away. I was almost 1 year into caregiving, and this was really an eye opener for me because it helped me to understand the importance of real downtime, not just a couple of hours, going off, hanging out with your friends or whatever, but real downtime where you could disconnect completely, totally disconnect. So now when I go away, I disconnect from the camera that's in my mother's room. Vice versa with my sister. When she goes away, I delete her from the camera because, you have to disconnect. You have to really have some respite. And that leads me to the last thing listed here, which is a support group. I think that's key for self-care. So my primary support group is the Binti Circle. And we like to say our tribe is a vibe. It has been a lifesaver for me. So we are able to share and be non-judgmental in our conversations, because a lot of what we share is what we say is real talk, because every day and most days really are not easy, but we do what we do. So these are the things that I identify as my important self-care items. So at the end of the day, I like to say there is music and joy. So it's not always easy. It is a labor of love. So with the, ups and downs and peaks and valley, we get through it. So this is my spicy mother here on the screen. As I mentioned, I like to take her out during the summertime to, events around town. So, at the end of the day, caregivers, we have to remember to take care of ourselves so that we can, be better caregivers for our loved ones. And I will stop my share and pause. I'm not sure if I think we're taking questions later.
Yes, that's correct. Thank you so
Okay.
much, Etola.
Thank you.
It was nice to hear your journey and how you're coping with it. And I just wanted to put in a plug for Binti Circle. Donita Brown, who's the founder of Binti Circle, was actually on CNN a few days ago because caregiving is also a part of the election agenda. So yeah, caregiving is important. And this leads me into our next presenter, who is Dr. Gupta. So our second presentation is Dr. Elora Gupta. Professionally, Dr. Gupta has spent many years in the pharmaceutical and medical device industry and has worked on Alzheimer's drug development. For several years, she was a caregiver to her father who had Alzheimer's disease. Elora has been a volunteer educator, community organizer, and advocate for caregiver support at the Alzheimer's Association for over 2 years. So today we're very excited to have her discuss strategies for caregiving activities, the types of care that may be available or needed during the caregiving journey, and local resources. So welcome, Dr. Elora.
Thank you for that introduction. Can everybody see my slide?
Yes, we can see it.
Wonderful. And I must say for Etolia, I'm sorry if I'm mispronouncing your name. As you were presenting, I was almost living my life, what it was like being a caregiver to my father, who I lost in 2018. Um, when I was going through this, it was I kind of knew about the Alzheimer's Association, but I really did not know all of the resources that were available. So my journey was just connecting with a few of my friends who were also going through the same thing, taking care of their parents and we would exchange notes and we would just support each other. And so after he passed away, I joined Alzheimer's because awareness and making people aware of resources, caregivers of resources, it is just so important. So today, what I'm going to present to you is provided by the Alzheimer's Association, but I can certainly address any questions based on my personal experience as well as what is provided by Alzheimer's, which is a tremendous association, provides so many resources that I can relate to. And I wish I knew about the association and I knew about these resources when I was going through my journey. So Alzheimer's has a series of presentation and which they call very appropriately empowered caregiver. And each of these presentations are pretty lengthy. They're about an hour in length. And so today I'll be presenting to you how you can support independence for the person you're caring for. So by way of introduction, um, most people with dementia, and especially in the early stages of dementia, they want to do as much as they can for themselves for as long as possible. That independence and that being able to feel that they can independently live their life. Point that was made that for some with MCI, mild cognitive impairment, many states still allow them to drive. And that is one of the reasons is to help them support this feeling of independence. And but importantly, when you are the caregiver, you will know the person the best. Thus, it is important that you know what is important to that person so you can help um, keep them independent and safe. No journey is the same. Even day to day, the experiences are different and completely unpredictable. So it is about adapting and taking care of them on a daily basis. Sometime morning to evening can be different. And it is important also to try to include the person living with dementia in conversations about the support. My father stopped talking for quite early in his condition, but I would talk to him all the time. I would call him, I could hear him breathe. There was zero response from him, but still I knew he was listening to me. So what we want to start off by presenting person-centered support for activities because each person is different, the disease manifestations are different, and they're different day to day. So, in the early stages of Alzheimer's, and it could be in MCI, a person is usually independent and they can conduct their activities, basic activities of daily living, like dressing, eating, or using the toilet and bathing. But then with time, they need more support. And then, therefore, you will need to adjust your support based on the person's needs and abilities. What the association is proposing is this four-step approach. First is plan your approach, simplify the process, create the right environment, then identify health issues. So let's look at an example of how you may apply that process. So an example of eating. So first, planning your approach. Think about the foods that the person likes and how they like them to be cooked. My dad loved lobster. So we would try to get the best possible lobster and cook it the way that he liked. He really enjoyed it in the beginning, but towards the end he forgot. He forgot how to chew, he forgot how to swallow, so we had to switch to mushy foods. But as long as he could recognize it, we made sure lobster was on the menu as often as we could. Then it's about meal times and flexibility. And they might forget they had eaten, or they might forget, or they might not perceive that they are hungry. And for some reason, they might be upset and they might refuse to eat. And that is okay. To wait and offer them food when they are ready. And also making having other cues that indicate that it's mealtime, like setting out making the place very inviting, setting the table, or filling their own plate. The next is simplifying process. And as was mentioned that now the person wants to eat the same food every day, and this is also the same message as only give a couple of food choices, give them time to choose, simple instructions, sit next to the person, make eye contact. And also, because oftentimes you don't know that they might have impaired ability to chew and swallow, just to make sure and that they're in the right consistency, the right size, and the person has the right instruments, the forks or knives or spoons that are easier to use. Third is creating that right environment. Noise can be very, very distracting to a person, and they might begin to perceive noise very differently. And many of them might also have hearing loss, and so they just want to be in an atmosphere that is quiet, comfortable. They don't have to listen to a lot of conversations that's happening around them. Sometimes they may not be able to follow if they have hearing loss, which can also make them more distressed. If you're playing music, again, something that's soft and relaxing, and very important to have very good lighting so they can see the food easily. And lastly, to identify health issues. Um, this is something that I can really relate to, that we could very clearly see when my dad lost his ability to chew or swallow, because you could see his cheek kind of swelling up. He tried to push the food in, and then his cheek swelling up because it was all sitting in his mouth. And so we didn't want him to choke on it. If dentures are worn, make sure they fit correctly. For my dad, that was a problem because he lost so much weight. Those dentures kept just like falling off. So we had somebody come into the house and measure him, but then the new dentures, they hurt. And so it was a real problem with it. But then at the same time, there could be mouth sores or swollen gums or loose teeth. And then so at this time, if it becomes really, really important to consult a doctor. So, apart from the activities of daily living, it's also important to make them take part in meaningful activities. So, how can you do that? So, this is again another aspect of staying independent. And think about the person's skills or abilities or hobbies that they enjoyed. And so, start out with doing those activities that they had enjoyed in the past. But you might need to make changes, obviously, depending on what the person can or cannot do. So it is important also, when you're kind of doing these activities that you knew in the past they liked, those preferences can change. So it is important to pay attention to what is now the new like. And if the person is happy or anxious or bothered, then plan those activities accordingly. Um, so in the past, my dad loved sports all the time. But towards the end, he didn't like it. It was too loud. It was too fast. He found it difficult following it. And so uh, we stopped putting that on TV. Um, Also, you could start an activity that's like really simple, like folding a towel or drawing the first dish. And again, make those steps as simple as possible, because one of the things with dementia is that you forget the chronology of the steps and you can miss them. So make it as simple as possible. And then it is important again to focus on the activity and not the result. Don't feel the need to correct them. And then also break it up in easy to follow steps so that they can follow along, or demonstrate it in simple steps. It is really important that you continue to talk to the persons, even if they may not be responding. I feel that they're still listening to you. And then if something is not working, try that again later. This is a really important part. It's difficult to do, is to find the right amount of support. Finding that right balance. If it is too little support to the person, then that person might get frustrated and give up. Or if you give too much support, then the person may not want to participate, and that's not necessarily good from the physical or mental health. So person-centered care is trying to figure out what could be the right amount of support, which would be just enough, and that can again change day to day. Some tips here are, first, consider again what you know about the person. You can ask the person, if they're communicating with you, how they would like to be helped. But then you monitor the person's the evolving needs, what their preferences are, or the mood for that particular day, and then change accordingly. Always start small, try to organize and make the environment as inviting as possible, and then always pay attention as to how this is going and make changes accordingly. Um, then while your focus should be on trying to give them as much importance, safety is really, really critical, which was also presented previously. So this is again another balancing act of how do you give that independence while ensuring safety. And so, particularly if the disease is progressing, then safety should take higher priority than independence. And it is important to put safety measures in place before an accident happens. So here are some examples. So first is home safety. And so it is really, really important to make sure that they don't have access to like tools, chemicals, or in this case, the stovetop knobs, other cleaning supplies, or other dangerous items. And actually, Alzheimer's Association has this very helpful home safety checklist. So if you go to alz.org/checklist, you can look at a list of all kinds of potential hazards around the home and what you can do about it. Next is driving, and that was also brought up earlier. Um, so it is very conceivable that at some time in that disease, you will need to take steps to not let that person drive. And so, in that case, you could certainly look at other transportation options. Like also, if you go to alz.org/driving, you can also look at how to make a plan to stop driving. Third is firearm or gun safety. This is really important anyways, but it becomes even more critical if you have someone in the house that has dementia. So removing the guns or putting them in a locked cabinet and making sure absolutely under no circumstances the person can get um, um, get access to that cabinet. And again, if you want to know more, you could go to alz.org/safety to learn more about firearm safety. And then lastly, it's about how can that person get around safely. It is important for the person to be able to walk, to be able to at least have that feeling of some level of independence in a safe environment for their physical as well as mental health. But fall hazards are really very, very serious. And so you have to look for places, you have to look for safety, like removing mats or any other places where other objects in the house where a person might slip, trip, or fall. Oftentimes, wandering is very common. It happened with my dad. He's always like leaving the house because he's trying to look for his childhood home or something. And so, you know, treat treating that person with dignity and trying to distract that person so that they don't walk, but they oftentimes do. Many of my friends had that experience of person leaving the house. They look for that opportunity and they're gone. And so to have a phone on them or have a GPS so you can locate them very quickly. Also to tell your neighbors if you see them wandering, to inform you, and also that there is a medical identification program where you can enroll the person. And then so important is managing your expectation, meaning you the caregiver. And so it is sometimes you might feel that you have made all these plans and taken all these steps to make sure that the person is comfortable, is independent, is enjoying activities they do, and then all of that doesn't come to fruition. But you have to keep reminding yourself to just like let it go, just to go with the flow. And then and just focus on what really matters and understand that this disease changes daily, sometimes hour to hour, and you just need to do the best you can. And so here are some of the various ways that the association can provide resources, including respite care as well. You have the 24/7 helpline, and these are manned by individuals who have been trained in the disease. And so they can answer questions in a reliable manner. They also have in several languages. I've forgotten the final count, but there are many, many languages that they can communicate with you. Local resources. I belong to the Greater Maryland chapter, but you can find your local resources easily by typing in your zip code. There are many support groups, memory cafes, etc., that happen that can also help socially, both for the patient and the caregiver. And then also, I would say, as I mentioned, there are several resources. If you go to alz.org, also ALZ Connected, as well as ALZ Navigator. And these are great tools where it's very interactive, and you can put in exactly what stage you are in, and it will come up with what you might think that you might be needing. And then also the Alzheimer's itself offers educational series. Oftentimes now, post pandemic, we do have many of these in person, and there are many also that are virtual that you can join. And with that, I will end my presentation and then join the group panel discussion.
Thank you so much, Dr. Gupta, for all that interesting and useful information. And it's always good to hear two different versions and that commonalities and some new things to learn. So at this point, I would like to transition to our panel discussion. And originally, Dr. Reverend Hathaway was meant to moderate for us, but unfortunately, he's not here because he's receiving an award somewhere. So it's for a good purpose. And so in his absence, Dr. Christine Holman will moderate the panel discussion. So I'll hand it over to, I'd like to thank both the presenters and hand it over to Dr. Holman for the panel discussion.
Yes, thank you, Valerie, and thank you both, Dr. Gupta and Mrs. Biggs. That was some really interesting and those were eye-opening presentations, for me at least. And we have a few questions here in the chat, and maybe I will start with them. By the way, just by brief introduction, my name is Christine Human. As you know, I'm professor of biology at Morgan State, and I'm the interim director of the Center for Brain Health Research at Morgan. So let me go, and Dr. Hathaway is receiving the Bridge Award, which is given out by Visit Baltimore, and their annual meeting is just going way over time. He had hoped to still make it here. The first question I'm seeing here in the chat, and I'm going to direct it to both. May I call you by your first name, Elora and Etolia, and I'm Christine? Okay. So I'm directing it to both of you. And the question is, are there laws and policies which guide how long a patient can live alone at home after an Alzheimer's diagnosis?
Should I start?
Sure.
That is a really good question, and I often get this, and I feel that that this can vary where you are. It can vary even within which zip code you are in this DMV. area, but also from state to state. And I would say for the go-to from an Alzheimer's Association standpoint is that the persons who man the phone, they have a current list of all those restrictions, all the resources, what you can get, what you can get, what are the free resources, etc. So the best place I would say to start is to contact them and let them know where you are and what your zip code is. And also, if it is, I mean, Alzheimer's is a nationwide association, so if it varies from state to state, then they can provide that information as well.
Etolia, would you like to add something?
I do not have anything to add to that, but I would like to piggyback just on the Alzheimer's Association and the effectiveness of the 24/7, because we've used that service before. So when you have, questions, they are there 24/7 to answer any type of question. So yes.
And if the person who asked the question in the chat wants to add something, please feel free to temporarily open your mic and add on if you had any specific ideas behind that question.
Thank you. It was me. Thank you, Elora and Etolia. You sort of answered it after I wrote it. I was just going by the, just the right amount of safety or assistance, and then the, safety guidelines, as long as I can't provide the safety or, arrange for safety, then it's time to, make other plans and call that number that was just put into the chat. Thank you for that too. So thank you.
So some other question I have here in the chat is we heard a little bit about the respite care from Etola, and this question is, could you tell us a bit more about different types of respite care that may be available and how to learn about the options? This was actually also a question I had. How do you connect to it? Maybe Etola, if you.
Yeah, so I'll say, it's really up to the individual. As far as the respite care, it just depends upon whether you're looking for, an organization or just planning your own respite care. There are some local, I'll say, type resorts or Sandy Cove, which is in Maryland, and also the Bon Secours Conference Center. Sometimes they have events, or it may be for caregivers, it may be a respite weekend. So some of those type organizations may have events specifically for caregivers. As I mentioned, for the Benty Circle, we also have our respite retreats annually that we do a lot of fundraising for to assist the caregivers who are in our organization. But on an individual basis, I would say just something that I started kind of last year out of necessity is I would just schedule, and being frank, I would, when Southwest would have the Gotta Get Away special, I would pick a city that I could get away to for probably under $100 round trip and just go for a short, weekend, 3 or 4 day weekend, because respite care really is so important in order for us to be, effective caregivers. So you could do something on your own, or you can, find some of the organizations that have events and functions for caregivers.
Maybe I misunderstood this question, but a question that's on my mind is, on the other end of things, who do you call in to provide that care?
Oh, well, when I go away, I have a wonderful person. It's called my sister. And she's on the call. Tammy Williams, my sister, comes for me, because actually that is a great question, because when you go away, it is very expensive if you're going away for multiple days to have someone come in. I do that. Now, depends upon what county you live in. Department of Aging has programs sometimes that will have hours that they have grant hours to give for respite care. So Department of Aging in each city, each county has different guidelines. So I have benefited from some of their scholarship respite hours a couple of years. So they do have programs. So I would say check with your Department of Aging. Department of Aging has a lot of great resources. They do training. They do in some cases have respite scholarships. So those are a couple of opportunities to check out.
Okay, that
Add,
please,
sorry.
yeah, please
Yeah.
go ahead. Yeah.
I can add that as part of the educational series, and especially on the empowered caregiver, the association has a whole separate presentation, which is not part of what I presented today, but it's like an hour-long presentation just on like respite care. And so they list out either, you could put out a request to them to come to your place, and we go to churches, I've been to libraries, I've been to parks, I've presented in many, many different places. But if this is a particular topic, then each of these presentations are put together with a lot of information. And so then they can present it. Also, they also have like a presentation schedule on their website as to if there are virtual presentations on just this topic, then you could just also just register and join. But it's a hour-long presentation of many tips and many resources. But as always, if you just need information, that 800 number is a good place to start, and they can provide you with information. I would also say if you try the Alzheimer Navigator, it's really good because I went there today just to check what updates they had made. So they keep on updating the tool. It will ask you what stages are you in the terminal stages and you're dealing with it, where it is really, really difficult. And if you click on it, then it has all, it's very interactive. So it will like break it out into all the things that you can do and resources available to you. So you may not want to speak to someone, but you can just do it on your own, very interactively.
Thank you so much for that information. Another question here from the chat is, what factors should we consider when deciding whether to change a loved one's care situation? For example, moving from care at home to long-term residential care. And I don't know who would like to take that first. Etolia, you're still an active caregiver. How would you look upon it? And then maybe next, Elora, whether this came up for you.
That's a tough question for me. Because long-term care or care outside of the home, leaving my home would be very expensive. It's probably not something we could afford, but it would have to become a stage where my mother, I would not be able to care for her in the sense of she's immobile. So right now she's still able to walk and talk and, all those things. But it's something that is probably like in the back of my mind. I'm thinking that I'll just be able to continue to do this indefinitely. Could be realistic or maybe not, but I know it is very expensive and probably not something that we could afford, honestly. So she probably will be with me for the duration.
It's a very tough choice. Towards the end, I knew my dad when he was still verbal that he wanted to be at home. And so in addition to all the support services, we had a full-time nurse because my dad was diabetic, he had hypertension, he had all these other, concomitant illnesses. Those don't go away. Those are there along with Alzheimer's. And so, his condition, when it very deteriorated, it was no longer possible for us to take care of him at home, and his personal doctor he also got so involved. So he came up with a strategy. He got one of his colleagues to come, and the doctors always did home visits, and who didn't have any of the ties, he didn't have all these years of association. And he came in and he said, he almost like yelled at us. He said, that's irresponsible. this guy, you cannot take care of him anymore at home. He's getting infections, he's getting all these other things. And you have to move him to long-term care, and you have to move actually to the hospital. And even though we knew that my dad did not want that, we had a conference amongst ourselves, and we said, okay, we should move. We didn't want to get into trouble saying the doctors are telling us that, we are being irresponsible and he's suffering and we don't move him to the hospital. And, my dad, even though at that time he was so non-responsive, he still indicated that he understood that we had moved him. And, but I would say thankfully, and that he passed away within a week after we moved him. Those are really tough decisions to make, and I think it's families have to decide what to do.
And I guess I'm hearing also, what are the financial options?
Those are. I know was part of an advocacy group for Alzheimer's where we went to Annapolis earlier this year. There is a section in the governor's budget to include financial support for caregivers. So we said that should continue to be included in the 2025 budget, and it was, but it can vary zip code to zip code. So if you would like to know what kind of financial assistance you might have, again, the 800 number is the best place because they know the most current information per your zip and what resources could be available to you.
And the law that you're talking about, is that the new law that was cited in this article about the high incidence in Baltimore and Maryland? Is that this new law? Or is
No, this has been around for a while, caregiver support. And I think that was one of the information that was provided. I was part of that trip to Annapolis, and we met with lawgivers, and that is something we presented to them. We presented our personal stories. We went with pictures of our loved ones, and then we said, look at these statistics. You have to continue to support this funding. And I think they might have added a little extra, but it was then put into the governor's budget. So it was renewed. But certainly all of that statistic did help us to make that very convincing case to the lawmakers. Yeah, we just said we were a sea of purple. It was very well organized. We met with a lot of people. We broke it up into groups and we went here, there, everywhere. So finally they said, okay, yes, we will renew it.
Well, they all probably look at their own lives too.
Right, right. Everyone, that first slide, right, on caregiving, everybody can relate to that. And if you had a parent, there is that genetic link. So I know with the advancing age and I'm at risk. So every time I look at this, I feel maybe I'm doing something for myself. So my children will be in a better position to take care of me.
Because it's dealing with communication, I want to skip a little forward to a comment that was left in the chat about that. Do you have any suggestions for communicating with a loved one who does not comprehend what the caregiver is saying? I've resorted to supplementing speech with a type of sign language. And the person who asked this question, please feel free to open your mic if you want to directly engage. If not, I'm going to...
This is Laura.
Okay.
I'm speaking about my mom. She just turned 91. When my dad died on December 17, 2021, my mom went from being sharp as a tack, taking care of the family finances, handling everything, to becoming depressed and developing dementia in the fastest time that I've ever known. The doctors were just amazed. In any case, as time has gone by, I've been her primary and sole caregiver since then. I took an early retirement. I've recently moved her from Northeast Pennsylvania down here to Maryland, where I reside. And I noticed approximately a year ago or so, my mom would say things like, "You talk funny, talk right, I don't understand." And then it progressed to the point where mom wasn't necessarily saying that, but I understood she didn't comprehend what I was saying. And I do use a type of, pointing to objects or, helping out as best I can. But I'm wondering if anyone else, whether they be on the panel or a participant in the audience, has dealt with that issue. And if there are any tricks of the trade that I can, sort of explore to continue communicating with my mom. My mom's very vocal. She talks nonstop to the invisible people because she has Lewy body dementia. But it is frustrating, to say the least, to not be able to communicate with her and communicate effectively. Thank you.
So
Can
who
I
like
Yeah, yeah, so that was my thinking also, that hearing loss in Alzheimer patients is common and often not recognized. So perhaps that is something to check about, her hearing. If she's saying you're talking funny, or with progressing hearing loss, she's hearing less and less of what you're saying. One of the things I might say is that when you're speaking with her, to face her, so she can read your lips, she can see the expression on your face and being able to understand better. But if she does have hearing loss, then definitely wearing hearing aids really helps. And there was the landmark Achieve study by Johns Hopkins and the Cochlear Center, and they found that if by wearing hearing aids, it slowed cognitive decline by almost 50%. 50% over 3 years. It's hard to get that with a drug even. And so it is a really big thing, is because both for hearing and Alzheimer, it's the brain that's involved. So, it's conceivable that they interact with each other. The other thing I can say is, for my dad, sadly, I think he might have had a hearing issue. I just didn't know. I mean, need to test for it. And I just knew his TV thing, he just kept louder and louder, and it was so loud. Oh my gosh. And, that's a clear sign, a very strong sign of potential hearing loss. We didn't do much about it. But the other thing is photographs. One of the things is that we found a picture of when he was very young, probably in his 20s, and this little black and white thing. So we took it over to Photoshop and we blew it up and we put it in front of him. And, he's like, first he didn't notice the photograph at all. And then all of a sudden you could see it's like drawing his attention. And those were the days when he was completely nonverbal. But then he recognized it, and you should see his eyes. He goes, he's pointing to the picture in himself. Like he could tell that's a picture of him. He recognized his 20-something old self. So, you never know what it strikes that chord, and how their brain is functioning in remembering things. So I would say those two: checking hearing and then photographs. So I'll hand it over
Just
to
to interject, yes, we corrected mom's hearing 7 years ago with top of the line hearing aid. She gets her ears checked twice a year. In addition, she does have age-related macular degeneration. So again, I mean, I'm battling, some physical, weaknesses that interfere with the ability to communicate, or for her to read my lips. I mean, she used to be a lip reader before she got her hearing aid.
Right,
So,
right.
but thank you.
Thanks. And I would just say that just to make sure that if you have top of the line, but again, just to make sure that the settings are correct, and just to make sure that even with the hearing aid and the settings, that they are just right for her now to be able to hear. And in those environments that she's probably not going out too much, so just that, I would say, just to make sure that the hearing aids are still effective for her hearing.
Yes, she gets her hearing checked twice a year, and
Oh, they
we
said that.
have them
Okay,
adjusted, twice a year if
okay.
there's a need to. And I
Oh,
also have
wonderful.
her the app on my phone, so that if I need to increase the volume because she's less attentive, I can do that. Or if she's being particularly sensitive to sound, I can lower the volume. Yeah, no, I use those techniques. I was just
Wonderful.
wondering if someone's actually, dealt with a loved one who really is not comprehending. They're just not comprehending. It's her brain is being eroded by the disease, and she just doesn't comprehend.
Thank you for those responses. I'm seeing new questions coming in, which is great. Let me circle back to a food-related question for a moment here. Valerie, if you want to directly address this, or do you want me to
I
read it?
I could, so to save you the reading, it's like I was piqued when Etolia, when you said this, your mom eats the same food every day, and my mom eats the same food every day for years. I was curious what your mom eats exactly, and Elora, if your father had a specific diet. Is this change in food also related?
Sure. So Valerie, so my mother literally, and you said 2 to 3 years, probably about the same. But early in the diagnosis, when she was still cooking, she would eat chicken and rice and beans that she would, cook. Dry beans, rice, chicken, she would eat that. And when she first came to live with me, she was still eating chicken, but I think the texture of the meat, she maybe wasn't able to chew and digest, even, cutting it up. So she now is by default a vegetarian. She no longer eats meat of any kind. She eats rice and beans and whole wheat crackers and organic peanut butter on the crackers. That's pretty much kind of her dinner. And breakfast is Cheerios and almond milk. And she has an apple every day in the evening. So, and as I mentioned, she doesn't eat snacks. And sometimes I try to tempt her when I'm driving through Krispy Kreme, through that drive-through line, and say, "Would you like a donut?" She says, "No." Um, Ice cream? No. Cake? No. Sometimes for holidays, she may try a little pie, but then she's she doesn't like it. But oddly enough, her numbers, when we go to the doctor, her numbers are great. She is quote unquote diabetic, but she's not on any medicine. We check her blood glucose blood sugar every day. We take her blood pressure every day. Her blood pressure has decreased. They took her off of her blood pressure medicine. So technically, we're really concerned, and we still are sometimes, that she's not getting the nutrients, but she's eating beans. So that's her fiber and protein. She's having the rice. She has the peanut butter. She has her apple. And sometimes she has green peas, but literally the same thing every day. So even when we try to introduce different things, it's a no for her.
Mm-hmm.
And, I know that sometimes, medication sometimes I think changes their taste buds, or just out of, what they're familiar with. Or if you ask her what she wants, she'll say those specific things. And when you give her something else, she'll look at it and she may take a little bit, and it's a no. So it works.
Mm-hmm.
I would say for my dad, who has been diabetic since he was very young, we had, restrictions on his diet. But I think towards the end, it's a quality of life. And so sometimes as a treat, a big bowl of noodles, and he would love that. So that was sometimes a treat, but generally his food was pretty standard during the day. But towards the end, when he forgot to chew, then we had to switch to liquid food. And at that time, we got, the food that's fortified with all kinds of minerals and nutrients and protein. We got from Abbott. It was big thing, and we would just mix it with some hot, and it would just like just go slide down, you know, once you put it in the mouth, it just like slid down. And that way, you know, he fed him. And I don't think at that time he had much about taste or any of that. He'd lost it all.
Thank
So
you.
Valerie, what does your mother eat?
My
You
mom,
said she's the same thing.
she'll eat rice, chickpeas, and salmon.
Mm.
So it's quite an expensive venture eating salmon every single day. Like she won't let us substitute it for anything. And then when she goes, because I'm originally from Kenya, when she goes to Kenya, salmon is even more expensive there. But she has to eat rice, chickpeas, and salmon.
Mm. Costco.
There's no Costco in Kenya.
No, but for you.
I think she goes back and forth, but yeah.
Um, I
Could I just ask, is that, I'm assuming that she doesn't like canned salmon. That's got to be fresh
Oh,
salmon,
no,
right?
fresh salmon.
Right, of course.
Well, yeah, in Kenya, I could imagine that would be very hard to come by salmon. We have a question here from somebody who's caring for a younger sibling in their late 60s. Whether there are any suggestions for that particular situation.
Yeah, that is sad to hear. That sounds more like YOD, which is young onset dementia. Is just sadly the progression of the disease is the same, but the person has a lot of energy, they're more physically fit, but the brain and the functioning and the decline, the cognitive decline is still the same. There is actually at Alzheimer's, there is uh, effort to actually bring more focus to IOD, because people only think Alzheimer's is, oh gosh, you're 70 plus or 80 plus or 90 plus. But I knew of a friend who had dementia in her mid 50s, and she passed away in 3 years. And we couldn't believe it. We thought the doctor had made a mistake till I joined Alzheimer's, and then I learned about young onset. I, you could, again, I would say try the 800 number. All I can say is there is a lot of effort within the association to focus on BioD. They are bringing in, like, there's one individual who's actually published a book that's only on young onset dementia case studies and what the individual families did to take care. And oftentimes it was the young, sometimes it was the very young children, teenagers, taking care of parents, or here a younger sibling taking care. It's Unfortunately, I cannot provide more information other than to say that there is a lot of effort within the association, and I would anticipate more like training classes or educational programs such as this, focusing on VIOD.
And I just discovered that we had a contribution from Maya Lewis here, a suggestion at Laura Glass. Maya, do you want to come on camera and share in person? Maybe not?
Sure.
Okay.
Hi. I just wanted to share that sometimes using pictures, like laminated pictures, if you print out different actions, that's something that I used to use when I volunteered with special needs kids specifically that were nonverbal. And I started to use that with my grandmother, who has dementia. Before she was bedridden, sometimes that would help us communicate. If she wanted to go on a walk outside, I'd show a picture of just someone simply walking, and that would kind of perk up if she wasn't understanding what I was saying, just associating trying to communicate, find different ways to communicate. I think that kind of falls in line with what Laura was talking about with using sign language as well.
Thank you, Maya.
Thank you. Let's see whether there are several comments here, but I want to make sure that I've caught all the question. There's one more message coming in. Okay. Corinne, do you want to go and jump in and ask that question directly?
I didn't have a question, but there was one from Ms.
Oh,
Nicole.
you meant take one more question. Okay.
Sorry.
Sorry. Go ahead, please. I didn't. Which one did you
The
want to?
one right above talking about that she noted that there, and Miss Arnold, if you'd like to hop on and ask your question, please feel free. The question. Oh, go ahead. Sorry. Yeah.
Hello.
Oh, Nicole. Okay.
Yeah.
Yeah, go ahead, please.
I really didn't have a question. It was just a comment. I was just observing that both speaker, the panelists said that they family members had diabetes, and then I was just thinking about the correlation between diabetes and dementia, and then also Alzheimer's. But I was just thinking about how my mom has dementia and my grandmother had Alzheimer's. They both had diabetes and had type 2 diabetes to be specific, which was a result of diet. So I was just making a comment that there was it was just not nice, but it was interesting to see that there was a trend. So not really a question, just a thought.
Thanks, Nicole.
Yeah. Yeah.
There are a lot of research issues there, I think, that need to be explored further. And I think we heard a few months ago in our last webinar that it's very important. And I think Etolia, you really pointed it out too, that once people have cognitive decline, that the diet is correct, because if the diet does not support heart healthy and diabetes healthy living, then the decline is faster. That was a message that I got out of the webinar that we had in the spring semester. We have these, by the way, twice annually, once in the spring and one in the fall. And as we're coming to a conclusion, if any of you have any particular topics that you would love to see addressed, this may be the time to put suggestions for such topics in the chat. While we sort of winding down, and I want to really thank Dr. Elora Gupta and Etolia Biggs for their contributions. This has been, for me, absolutely fascinating. And looking at the chat, I'm seeing a lot of very positive feedback, so that it's been very helpful to people in attendance here today. So thanks again for being here and sharing with us, and thank you in the audience for sharing with us too. So I'm going to hand it back to Valerie, to Dr. Oderamara, to maybe come up with some concluding remarks, and also Dr. Corinne Pettigrew, if she would like to come up with some concluding remarks.
Thank you, Christine. And so at this point, I would like to again echo a big thanks to Etola and Elora for all the caregiving that you did and you still do, and that you care enough to still be involved in the Alzheimer's Association. And we've learned from each other, not just from the presenters, but from the audience. Sharing your stories has also been very helpful to learn from each other. And that's why we do these discussions and events. We hope to learn from each other what works, what doesn't work. And so I'm very thankful that you were able to make it today. And I look forward to you all making it for our future events. And as we said, please give us some topics that you're interested in, and we'll see where we can get speakers for it. And thank you to Corinne, Dr. Corinne Pettigrew, who's really instrumental in organizing these events. And is there anything else, Corinne, that I was meant to say?
No, I think your closing remarks were beautiful and you covered everything. All I can do is echo what you said and thank everyone for attending, and both Etola and Elora for your great presentations and sharing your personal perspectives and experiences.
Yes, and so we'll see you all in the spring.
Yes.